Yesterday, we saw more than 3 million COVID cases globally. We also have seen 200,000 deaths, and we know that the mortality rate probably is 60% higher than registered. World leaders are faced with a lot of dilemmas.
In fact, all through the pandemic and as it developed across the world, India charted a rather different course in response to this pandemic. India was united in taking decisive action. The center and the states worked together in tandem and have implemented possibly one of the most stringent lockdowns that any part of the world has seen. And the good part is, across the last 40 odd days, not one single case of starvation or lack of essential commodities anywhere in the country.
We took measures from early stage, making sure that we are protecting our people here in Qatar and by doing a lot of tests and isolation. Our private sector here, they work together in collaboration, so we start to produce protective gears like masks. For example, we are producing right now 8 million masks every week.
I'm tempted to say that nobody really knows what's going to happen in the future because it's something we haven't seen before. I don't think we're going to go back to the normal conduct of after a typical recession. This time, the world has been scarred in many ways by the prospect of death by a virus that we really don't know much about yet. The business community recognizes we're in a recession, and the business community is doing these things. One, cutting costs, making certain their employees are okay. The businesses are going to use fewer employees than they had before because they realize they don't need as many employees because people are going to change their conduct. People aren't going to buy the same amount of products in certain areas as before.
We got lucky on this one, even though there's a lot of suffering, a lot of people worried. If you think about it, first, our children are mostly not impacted. Think about the calamity this will be right now if we were losing 10% of the children. Our plan is to partner with somebody who has the scale and the capacity to help us get from the 100 million doses that we can do with our own plant to the billion range.
So the platform that we're collaborating with World Economic Forum and a number of companies, including Ipsos and Novetta, really are working to provide data for decision making for policy makers. There's a lot we still don't know about this disease, especially how it's going to work in populations that are very young. For example, in Sierra Leone, the average age is 19.4 years. So what does this outbreak look like in those young populations? How do we also make sure that we don't cause a secondary humanitarian crisis with malnutrition and economic collapse?